Welcome to Bimini Medical's Matriskin brand training. Today we're going to look at the Matriskin brand and how to incorporate this home care range into your solutions that match up perfectly with your in-office procedures and can be incorporated regardless of the other brands that you already stock in your clinic. Matriskin is a product line of the French ESPA group who manufactures effective skincare and nutritional supplements with a tradition of scientific research and the successful product development going back many different years. This is a classic French brand that has a few unique selling points. There is an interdisciplinary link between science, biology, and medicine. Their research and development team consists of scientists that have their expertise in the laboratory, biologists, which are experts in microscopic organisms and cells, and then physicians who have the hands-on experience in dealing with patients' skin and treating patients on a clinical basis. The main task is to find carefully selected active ingredients that have proven biological activity in the skin, but also to put these active ingredients into formulas that are effective and safe to use on the skin. They use the highest concentration of active ingredients that are needed to provide benefits and proven results for patients that have various different concerns in the skin. The Matriskin product line are characterized by using high concentration of active ingredients. It's not always the quality of the active ingredients alone that matters, but if they suspended in a concentration that is effective when applied to the skin and that can penetrate effectively to produce visible results. They use patented molecular sizes which allow these active ingredients to penetrate deeper into the skin where we need them to work. These products have a preventative, curative, and stabilizing mechanism of action, so they can be utilized in younger patients to prevent specific clinical signs of aging on the skin. They can treat visible clinical signs of aging, and they can act as a maintenance range for patients that have already achieved good results from procedures. They use unique product combinations that are available and suitable to be used on various different skin types, and they use innovative products that don't compromise on safety. All the ingredients selected for the Matriskin brand are subject to clinical trials, and they only use clinically proven ingredients in the products. They source ingredients through biotechnology, and they have a unique high-tech extraction method. These products will not produce any visible side effects or any downtime on the skin, so they do not create any anticipated reactions and are suitable to be used both pre and post procedure. All of the Matriskin products are safe to be used during pregnancy and breastfeeding. They are vegan friendly, 100% halal, and contain minimal fragrances and preservatives. These products are formulated with the latest technology in mind, utilizing the best formulations so that we can get visible results on the skin. Matriskin is not a very large brand, so Matriskin fits in perfectly with many other brands that you might have in your clinic, and it also is the perfect partner for a procedural approach because you can use it to precondition a patient for procedures. You can use it during procedures, during your active treatment phase where we are reversing visible signs of aging on the skin. We can also use it for very specific indications like extreme dryness or saggy skin or puffy eyes. So there are various different solutions, and as I've said, because they are so multifunctional, they can easily be slotted in to multiple other ranges and procedures that you are currently using in your clinic. The Matriskin range is divided into three different ranges, or the Matriskin brand is divided into three different ranges. You have your revitalizing range, which is specifically indicated for patients that have visible clinical signs of aging. So they have dry or dehydrated skin, they have lines and wrinkles, laxity or a loss of elasticity. They could have a poor cell renewal rate, which results in a dull or sallow skin. And this range will be utilized during the active treatment of visible signs of aging. They include ingredients which are proven to reverse certain signs of aging in the skin, focusing specifically on restoring those extracellular matrix components that become damaged over time when we are exposed to extrinsic aging factors. Now, the enhancing program is specifically indicated for patients that have extremely sensitized barriers or patients that have had procedures done and need post-procedure solutions. These products focus specifically on restoring those elements that are responsible for maintaining skin barrier function, such as the acid mantle, natural moisturizing factors, epidermal lipids, and maintaining the water supplies in the skin. It also reduces redness and sensitivity in highly reactive or sensitized barriers. Matriskin is famed for their eye care solutions. They have some extremely unique patented technologies that treat a variety of concerns that is not often treatable in a normal clinic situation with topical products. This includes solutions that treat dark circles, puffiness, lines and wrinkles, and excessive fatty tissue below the eye area. Now, before we can move on to looking at the individual ranges in this brand, it's important for us to have a thorough understanding of the skin and its various different structures so that we can apply our knowledge on the active ingredients and the skincare technology better. Now, the skin is much more than just a covering on the body. It is much more than just a covering over the organs, muscles, and bones to protect underlying structures. The skin is a very sophisticated communication vehicle which communicates with internal structures and the external environment on a day-to-day basis. We must have respect for the fact that the skin forms a crucial part of our immune responses and acts as our initial defense mechanism against anything in our extrinsic environment. The skin is a sophisticated organ which is involved in many different factors that maintain homeostasis and health in the body. The skin is a diverse organ which basically encompasses various different levels, various different cells that all play an important role in maintaining the health of the body. In order for us to understand the skin better, we have to understand the various different layers of the skin effectively. How do we need to target the epidermis if there's specific clinical signs and symptoms that we want to address? Which clinical signs and symptoms require of us to target the dermis directly if we want to see improvement in the skin? These are some of the questions that we need to answer before we can determine which range or which brand would be best for the patient. The most superficial layer in the skin, which is called the epidermis. Now, some of you might already have a lot of knowledge on the epidermis, but I want to go into a little bit more detail here. The epidermis is made up of 5 different layers consisting of the stratum basale, the stratum spinosum, the stratum granulosum, and the stratum lucidum, and the stratum corneum. Now, the stratum lucidum, although it's mentioned on this image, is only present in the soles of the feet and the palms of the hand. So for the purpose of this training, because we're focusing on the face, we're going to look at the other 4 layers in greater detail. In your basal layer of your epidermis, which is connected to your dermis via the dermal-epidermal junction, we have our initial formulation of keratinocytes. Keratinocytes is the major cell that is present in the epidermis, and keratinocytes are produced in the basal layer of the epidermis. The epidermis also has the melanocyte, which is present in the basal layer of the epidermis. And the melanocyte, as you know, is responsible for creating melanosomes, which make melanin. And melanin is the pigment that colors our cells and involved in various different immune functions and protective mechanisms to protect the cell against damage. Now, because the melanocyte is situated in the basal layer of the epidermis, it can sometimes be difficult to treat hyperpigmentation disorders effectively and quickly. And if we look at the mechanism of action of how pigmentation is transferred into the keratinocytes, this happens as a result of dendrites. Now, each melanocyte is going to come into contact with about 30 to 36 different keratinocytes in its surrounding environment. And in the stratum spinosum, the transfer of melanosomes take place into the keratinocytes, where they deposit melanosomes into the keratinocyte to eventually form melanin or pigment into the cells. And the major function of the stratum spinosum is this transfer of melanin into the keratinocytes. If we look at how quickly it takes for the keratinocyte to progress from the basal layer of the epidermis up to the surface layers of the skin, this process can take anywhere from 28 days up to 40 days or 6 weeks. The reason it differs is because different ages have a quicker or slower cell turnover, and certain skin diseases can also influence the rate at which this keratinocyte moves from the basal layer in the epidermis up to the stratum corneum and eventually sheds off. The keratinocyte has quite a unique role in the sense that it is programmed to die the moment that it is born. So the keratinocyte moves from the basal layer in the epidermis up to the superficial stratum corneum, where it will eventually lose its nucleus and shed off of the skin. Now, this journey is important to understand because it determines skin barrier function. The rate at which this keratinocyte moves from the basal layer up to the stratum corneum is important because if the keratinocyte does not shed off quickly enough, it means that our stratum corneum has certain areas where it has a smooth surface and other areas where the stratum corneum adheres for too long to the surface of the skin. In the stratum granulosum, the fatty makeup or the structure of the keratinocyte changes slightly. This is also called the granular layer of the epidermis, and we call it the granular layer because the keratinocyte appears granular under a microscope. The granulosum is an important layer in the epidermis because this is also where your lipid bilayer is formed. Now, the lipid bilayer is a double-layered lipid membrane which protects us against water loss that is produced in the dermis, and it also protects us against any external elements that could potentially damage the skin. Now, the lipid bilayer is made up of epidermal lipids, and these epidermal lipids play a very important role in skin barrier function. These epidermal lipids will prevent moisture loss from the skin, and they will prevent the damage of extrinsic elements to the skin. The epidermal lipids are made up of 3 specific lipids, which are your free fatty acids, your cholesterol, and your ceramide. These lipids differ in their structure to the lipids found in sebum, so they are not the same thing and they play a vitally different role. But what is very important to remember is that if there's a deficiency of epidermal lipids and natural moisturizing factors, our desquamation of dead skin cells will be impaired negatively. The reason for this is the production of lamellar bodies. Lamellar bodies are molecules made in the stratum granulosum, which are responsible for creating the enzymes that dissolve the little desmosome bonds between keratinocytes, which will eventually cause the shedding of dead skin cells. Now, these lamellar bodies can only produce enzymes needed for desquamation in the presence of water. And if there's not enough water in the skin, that means that these lamellar bodies are deficient. So we need enough moisture in the skin to enhance natural desquamation processes in the skin. Moving up to the stratum granulosum. In the past, this used to be considered a dead, functionless layer in the skin. Today, we know it's far from a functionless layer. The stratum corneum is made up of dead skin cells or anucleate cells and an acid mantle. The acid mantle is made up of a combination of sudoriferous or sweat secretions and sebaceous secretions. So if a patient has a skin that is slightly too oily or too dry, their acid mantle is impaired negatively. This means that the acidity of their pH is impaired negatively. Now, we need the acidity of the stratum corneum to be at a specific pH to encourage the survival of good or healthy microflora on the skin. The microbiome, which is a layer of good bacteria, is going to protect us against harmful microorganisms, and for that we need to maintain a healthy acid mantle. And these are some of the factors in the epidermis that play a role in maintaining skin barrier function. The specific factors that we need to take note of in terms of ensuring that we restore barrier function is restoring the acid mantle. Part of restoring the acid mantle is ensuring that the patient is using a good quality cleanser and toner that is going to maintain and preserve the integrity of the acid mantle. We need to discourage them from using harsh cleansers that strip the skin of its natural moisturizing factors. We need to ensure that the skin has enough epidermal lipids to prevent transepidermal water loss so that we have a slower transepidermal water loss. So epidermal lipids are made up of essential fatty acids, and these fatty acids can be found in many of the Matriskin topical products. We also need to ensure that there's a balance in sebaceous secretion so that there's not too much production of sebum, because this will alter the acid mantle and exacerbate acne. Glycoaminoglycans, which are produced in the dermis, are responsible for making the hyaluronic acid in our skin that keeps our skin plump and prevents wrinkles and lines from forming. So we need to encourage the production of glycoaminoglycans in the skin at all times. Moisture is very important because the natural moisturizing factors in the dermis, which filters through the epidermis, is responsible for activating the specific enzymes that are responsible for initiating desquamation of dead cells. If we do not have enough moisture in the skin, we will not shed our dead skin cells effectively, which could lead to a dull, damaged stratum corneum, blackheads, and it can exacerbate acne. It can even worsen hyperpigmentation disorders because it encourages dark epidermal cells. Enzymes are any substances that act as a catalyst to bring about specific biochemical reactions. So wherever we refer to an enzyme, we are referring to something that makes something else happen quicker. Physical signs and symptoms of an impaired barrier is a dry, uncomfortable, and sensitive skin that is prone to redness. These patients often have excess keratinization and a blockage of the follicles, which results in blackheads and comedones. They often have an intolerance to skincare products, and they often complain that their skin is highly sensitive when they apply a medical grade skincare product to their skin, and they tend to have fine vertical and horizontal lines on the skin. This tells us that the enzymes that are responsible for initiating desquamation is impaired negatively as a result of too little supply of natural moisturizing factors. Restoring skin barrier function can be done in various different mechanisms. So topical products must be introduced into the patient's routine for the first 4 to 6 weeks when we've met with them and done an initial consultation. During the 4 to 6 weeks that it takes for the epidermis to renew itself, we can restore barrier function with the correct home performance or home care products. Now, this is very dependent on the severity of the skin condition, and we need to make sure that the patient understands that we will first analyze their skin after 4 to 6 weeks to make sure that their skin is in a healthy enough condition to warrant us doing a procedure on their skin. We must focus on restoring the balance between sebum secretions and natural moisturizing factors, and we must encourage natural enzymatic activity by restoring the water levels in the skin so that we get an accurate and effective desquamation of dead skin cells. The last thing we want is a buildup of dead skin cells, which will then result in our products not penetrating effectively, and also a disrupted acid mantle, which then removes our skin's ability to protect us against extrinsic elements. So a checklist for restoring skin barrier function involves eliminating the triggers of inflammation in the skin. So we need topical anti-inflammatory ingredients. We need to make sure that we are reducing excessive sebum production. And we need to make sure that we are very careful when performing procedures on a damaged barrier. This could result in post-inflammatory hyperpigmentation. So utilizing a good quality medical grade skincare range before we do a procedure is advisable so that we can prevent damage to the skin after doing a procedure. When we go through the technical knowledge of the Matriskin products, we will refer to clinical studies. And clinical studies is important to understand because a clinical study is done to ensure that an ingredient is effective, that it works for the purpose that it is introduced into the routine, but also that it is safe to use on the skin, that it has been tested for safety. We often refer to in vivo tests and in vitro tests. Now, in vivo tests is a medical test where the experiment or the procedure is done on a living organism, such as an animal or human cell. So the test is done in a laboratory on a cell from a human or animal origin. In vitro means that the medical study is done in the laboratory in a test tube or a laboratory dish. So it's not actually tested on live human or animal cells, but rather is tested for safety in a laboratory situation. Getting to the dermis, it's important for us to understand that when we see certain clinical signs and symptoms on the skin, we need to be able to identify how deeply in the skin we must work in order for us to improve those specific signs and symptoms. When we look at the diagram on your skin, you will see that the skin is far more involved and complicated than a simple two-dimensional organ. We need to remember that the skin is made up of different layers. We've just discussed the epidermis, which is the most superficial layer in the skin, and it's also made up of the subcutaneous level, which is basically where our fat cells are situated, and this is below the dermis. Now, the dermis makes up the bulk of the thickness of the skin, and it contains various different organelles. It contains our hair follicle, our sebaceous gland. It contains blood vessels, blood capillaries, lymph vessels. It has sebaceous glands, apocrine glands, which are your sweat glands, and it has various different functions and structures that make up the extracellular matrix. Now, the extracellular matrix is the extrinsic space outside of the cells that make up the bulk of the connective tissue in our body. So when we refer to the extracellular matrix, we are basically referring to the dermis. There are multiple different elements in this extracellular matrix space which will be responsible for the way that our skin looks, from a visual observation, but also for the way that our skin functions. And in a younger skin, all of these extracellular matrix elements are in place, they are present, they are working properly. But in an older or more mature skin, we often find that these extracellular matrix elements are deficient in some way. Now, the extracellular matrix is responsible for giving the dermis its shape and its structure, and it basically supports all of the cells that are enclosed in the dermis. And some of these cells include your mast cells. Your mast cells are responsible for creating histamine during injuries and allergic reactions. Your macrophages. Macrophages are immune cells that engulf bacteria and harmful microorganisms. They basically look like a little Pac-Man. They engulf the foreign material and they self-destruct. They go into apoptosis. So there's various different immune cells and other cells present in the dermis. The most important cell when it comes to restoring a smooth, healthy skin is our fibroblast. The fibroblast is situated in the dermis and is responsible for creating all of the structural proteins in our skin. It controls cell identity. What this means is that the extracellular matrix contains various different stem cells. Stem cells are undifferentiated cells. They haven't turned into a specific cell that has a specific function yet. So the extracellular matrix will control cell identity. They control the proliferation and fate of the cell, whether the cell dies earlier or later. It plays a big role in facilitating cell-to-cell signaling and communication, because the epidermis and the dermis is in constant communication with each other. And the keratinocytes or skin cells produce growth factors, which are protein molecules. And these protein molecules are messenger molecules that have an effect on nearby cells in the surrounding environment. The dermis or the extracellular matrix plays a vital role in repairing wounds to the skin and contains many of the different elements needed to initiate the wound healing responses in the skin. It also plays a big role in cell adhesion and tissue function. The dermis is made up mostly out of structural proteins, which are example of these is your collagen and your elastin, specialized cells such as the fibroblast, and proteoglycans. Now, proteoglycans is another way of describing glycoaminoglycans, which make up the bulk of the dermis. This is made up predominantly of hyaluronic acid, which gives the skin a plump, well-nourished look. And these elements will be what determines how healthy the dermis is. So if we have a deficiency of structural proteins like collagen and elastin, it means that we will see lines, wrinkles, and laxity in the skin. If the fibroblast is less active than it was when we were younger, it will produce less collagen in production. And if we have a deficiency in glycoaminoglycans, this can result in moisture loss, volume loss, laxity, and deep static lines and wrinkles. The dermis is a very complex layer in the skin and consists of many different types of collagen, including type 1, which is the structural collagen that is found in bones, skin, tendons, and other organs. It is also the most abundant or common type of collagen. Type 3 is your young collagen, which is mainly in fetal tissues, and it accounts for about 10 to 20% of the collagen in the adult dermis. Type 4 collagen is mainly present in the basement membrane of the skin. Collagen is made up of building blocks called amino acids. Amino acids are the building blocks of all forms of protein in the body. Now, how collagen is formed is a complicated process because these amino acids, which we get from the food that we eat, need to bind together to form chains. And these chains are called peptides. Peptides are chains of amino acids, and this is an important aspect to understand because later on in the training we will refer to peptides being used in the topical products. Now, wherever you see the word peptide, it refers to chains of amino acids. Now, collagen is a very large molecule, which is difficult to get deep into the skin because of how big it is. So often we need to include chains of amino acids, which are basically smaller building blocks of collagen, because they can penetrate deeper into the skin to give the skin the ingredients that it needs to make its own good quality collagen. Now, these peptide chains twist together to form a triple helix, and this triple helix comes together to form a collagen fibril, and the collagen fiber is made up of collagen fibrils, which basically bound together to form these fibers. Collagen induction can take weeks, and we need to make sure that the clients understand that because it's such a complicated process, they might have to wait a while before they see results with microneedling or collagen induction therapy, as well as topical ingredients and products. Elastin is a highly elastic protein that makes up the bulk of the connective tissue. It allows many tissues in the body to resume their shape once you've actually provided tension or pressure to the skin, and it helps the skin to contract and return to its original position once you have actually applied pressure to the skin. As mentioned earlier on, the fibroblast in the dermis is the most vital cell to restore health to the dermis. Now, when we do collagen induction therapy or when we do a procedure that injures the skin, this activates the function of the fibroblast, especially in individuals that find that their fibroblast function has diminished over time due to the fact that they are aging or due to the fact that they've been exposed to extrinsic aging factors. Now, as you can see on your screen, the fibroblast is responsible for making many of the different elements in our dermis that make up the bulk of the dermis, including collagen fibers, enzymes, extracellular matrix elements. They also produce growth factors, and growth factors are protein molecules which are capable of stimulating cell proliferation. Every cell in the body has the ability to produce growth factors because growth factors are needed for cells to multiply. Now, when we have an injury or a controlled injury in the skin, the fibroblast produces many different growth factors, which can in turn stimulate the production of new fibroblasts so that we have a higher output of collagen and elastin production. The fibroblast is also responsible for creating hyaluronic acid, which gives our skin its moisture and it gives the skin its bulk. Now, if we want to stimulate the production of new collagen, we have to target the fibroblast directly. If we want to prevent aging from taking place or prevent the escalation of aging, we have to maintain the integrity and the health of the fibroblast. And we can do this by including specific ingredients in our topical regimens, but also using a good quality sunscreen to protect us against sun damage. The dermis also contains adipocytes and pre-adipocytes, which will eventually form the fat in the body. Some facts about the dermis include new collagen and elastin cannot be made when there's a buildup of dead cells and old fibers in the skin. Now, there are certain enzymes that are produced in the body naturally that removes damaged old collagen fibers to make way for new collagen fibers. These enzymes are called MMPs or matrix metalloproteinases. Now, the matrix metalloproteinases is responsible for removing unhealthy collagen or damaged collagen fibers. When we are exposed to too much UV radiation, our body cannot regulate the production of these enzymes. So we produce too many MMP enzymes, and they start removing or destroying not only the damaged or unhealthy collagen, but also the healthy collagen fibers in the skin. In order for us to prevent the generation of too many MMP enzymes, we need to ensure that the client is using a good antioxidant such as vitamin C, and that they are using sunscreen diligently every day, regardless of their external environment. We've spoken briefly about peptides because peptides is a technology that is frequently used in the Matriskin products. Remember that we almost want to provide the body with a recipe, the ingredients in the recipe, so that the eventual collagen can be formed. Now, one of the key elements in making new collagen is providing it with the building blocks of protein, which includes peptides that can further be broken down into amino acids. As mentioned before, these building blocks of amino acids form peptide chains, which form a triple helix structure that eventually forms the collagen fibrils, which bind together to form collagen fibers. When looking at the eye area specifically, we know that the skin around the eye area is on average 7 to 10 times thinner and more delicate than the skin on any other part of the body. Now, this is generally the first area where we start seeing the symptoms and signs of aging, purely for a few reasons. One being that patients very seldomly protect the skin around their eye area when they are younger because they don't have any visible concerns. Then we also see that patients are not diligent enough with the application of products around their eye to restore collagen and elastin to the skin. Some problems that commonly occur around the eye area is dark circles, which is usually as a result of the dense capillary network beneath. So this dense capillary network means that there's a healthy blood supply around the eye area. But this can result in the blood looking almost purplish underneath the skin, which makes the skin underneath the eye appear dark. Sometimes these capillaries can actually get very weak and they can break. And when this happens, fluid leaks into the extracellular space, which can cause puffiness around the eye area. Now, puffiness can be caused by many different factors, one being a retention of water, and we can check for this by placing some pressure with our pinky or ring finger underneath the eye and seeing how quickly the skin returns back to normal. With a patient that has excessive fatty deposits around the eye area, it will be almost a movable solid mass of adipose tissue underneath the eye that does not move or change its shape when you place your finger in it. The skin around the eye area has very, very few sebaceous glands, and we therefore need to enhance the patient's protocol by including a rich, nourishing eye cream so that you can get good results. There's a poor lipid barrier, which means it's usually the first area to get dry and sensitive if the patient has a damaged barrier on his skin. Some common causes for puffy eyes include allergies, water retention, infections, sinus problems, and certain hormonal imbalances. If a patient has a fatty deposit underneath her eye, the cause is generally the anatomical changes that take place when we age. We often see a loss of adipose tissue around that little fat pocket. We also see bone loss in the face, which can result to a sunken look with a puffy little spot of adipose tissue underneath the eye. The lower lid can become either hollow or it can become puffy because there's an adipose deposit around the eye area. Now that we have a little bit of knowledge on the eye area and the skin, we can move on to the various different Matriskin solutions.